And now, Hard Facts. Hard Facts with Dayo.
Welcome back. Still Hard Facts at 90.3 Nigeria Info, Heron Port Harcourt and Dayo. 8 minutes come past 5 p.m. Conversation does continue at this time. And still discussing healthcare related matters, however, away from COVID-19 right now. And discussing next the general healthcare system or structural apparatus in Nigeria and the state in which it is at the moment, and what players or what professionals in the field are doing or not to address that situation. Now, this is on our news yesterday, I do believe. The Medical and Dental Consultants Association of Nigeria, MDCAN, has again extended the ultimatum given to the federal government to resolve their demands by another 6 weeks. Chairman of MDCAN at UPTH, Dr. Chukwuemeka, argued to our correspondent that the consultants do not want to further cripple the health sector as resident doctors are on strike. Here's what he had to say.
You know that the PDP chairman is not as popular when it comes to...
All right, pardon me, I think that's the wrong one. Here we go.
We've asked the members of the National ESCO to continue to liaise and deliberate with officers of the Ministry of Health, the head of service, as well as education. We have also tried to see how we can continue to offer service, however skeletal they may be, so that there will not be a complete breakdown. We know that all life is sacred, but we shouldn't lose our own lives while caring for others. We support members of the Association of Resident Doctors. And when the time comes, if this is not fully resolved, well, we'll be in the same camp with them.
Now, remember that, you might recall, rather, that MDCAN on July 26 issued a 21-day ultimatum to the federal government over salary scales, and I do imagine a list of other issues as well. Well, several talking points here, no doubt, but is there hope in sight? The issues in Nigeria's healthcare sector will be resolved sometime soon. Well, joining me for this conversation, Dr. Chukwuemeka Agi, who's chairman of MDCAN at UPTH. Dr. Agi, good evening to you. Welcome to Hard Facts.
Good evening, Dayo, and good evening to our listeners.
Now, let's start on this note. How would you describe healthcare delivery system in Nigeria at the moment? And I think it might be safe to say it's not in a good place, but I'd like to hear your description of it, and also what exactly are the challenges?
Well, you have captured it correctly. It is not in a good place. And so at best, we'll just say it's a chaotic care that will give patients. It is an incomplete care. It is a care that is not holistic. And then, we try to paint a picture that we're doing our best. But in truth, we all should aim to be better at what we do, tomorrow, compared to what we're doing today, but that is not the case. And so we have an incomplete, we have a system that is very, very incomplete, in taking care of the needs of our people. And so I will just say that we are not doing the best we can. That's the truth. We are properly trained. We have the requisite, skills, but the system, there are extra medical things. There are things in the, societal things, governance issues, systemic issues that make it virtually impossible for us to render good service to our people. And so it is not, we're not in a good place at all.
Can you break down these issues, these systemic and governance issues that you described that's militating against, an appreciable level of healthcare delivery in the country?
Well, okay. Like I said, there are extra medical or, systemic things, and then there are things within the health sector. Take, for instance, we have pediatricians who can care for children when they have diarrheal diseases, they are vomiting. We have obstetricians who can take care of women who are pregnant, But if that woman comes from a community where they just have nothing, and then to transport herself from wherever she is to the hospital becomes a major issue. We know places like Iche have, bad roads and all that. It's not been taken care of. So getting to the hospital becomes an issue. That woman might die in the process. We have UPTH as a tertiary health institution to transport somebody from any primary or secondary healthcare facility to the hospital might pose a challenge. There might be roadblocks. People might die in transit. So that becomes an issue. The second thing is we have policymakers who make policies that are not really working. Now, somebody might even have money to buy drugs. The drugs are not available. And so the individual will suffer, and then people would lose their lives in the process. And then we also have issues where you find out that, we lay emphasis on the things that don't matter. For instance, we might hear the saying that people were being fed during the pandemic, running into billions, being fed, just fed. But, and we know that, look, there are so many more major issues, like equipping the hospital, system, getting things to work. From when the pandemic broke, Dio, to now, we have not added any real equipment to the care we give to people in terms of what? Ventilators, in terms of, taking care of, various emergencies. Healthcare delivery is especially important for emergencies, not what we refer to as cold cases. I have headache. I can continue to live my life for another 3-4 days until maybe the headache either goes away, my body, shackles whatever was disturbing me. But when somebody says, look, there is a rupture of an appendix, you have to attend to it, or there is an appendicitis. A woman is in labor, is obstructed, you must attend to it. So these things are not, we're not that well equipped. So, we see ourselves as being helpless. We have the requisite knowledge and then the experience, and skills to be able to, impact on things. But all these other factors are mitigating against us, like I said. And so we're, between the devil and the deep blue sea. What do? Recently, so many doctors were leaving the shores of Nigeria for other climes. And it is no secret that doctors from Nigeria form a major workforce in so many countries outside this place. In the UK, quite a huge number. In America, if you have 3 blacks, one will be a Nigerian. In all over the world. So you find out that it is not the skill that is the issue. It is not the ability to perform these things, but rather the systemic issues, like I said. So the emphasis is not laid properly, and then we don't equip the hospitals, ensure that things work in the other aspects of the society. And so everybody suffers for it. That's just the truth. That's just the truth.
The resident doctors, National Association of Resident Doctors, have been on strike for some weeks right now, and they've been engaged in this battle, if you will, with the federal government. It's been ongoing. What is MDCAN's position on NAD's strike?
We are totally in support of the National Association, Nigerian Association of Resident Doctors, NAD. We are completely, with them. In truth is, like I mentioned to your colleagues that interviewed me a few days ago, we don't want the system to completely collapse. We must always give room for hope and to say, look, let us resolve whatever disturbing us. But the issues they raised are quite pertinent. There are, for instance, doctors are not being given even their basic due. We're not. The federal government or the government, said they were asking members to being paid on a particular platform. Now, the expectation will be a government that says, no, don't pay on this platform. We are going to pay you on this new platform. We'll be able to take those who are on that old platform to the new one. It has not been done. And so, Dio and members of the public, as we speak here, there are doctors who have not received a salary, a dime, since this year. This is the 9th month of the year. No salary. Now, they are not, this system, we said, the one that they have closed is called the Give Me platform. The one they have opened in order to pay members of the hospital, not just doctors, is called the IPPIS platform. They have not come to do this registration, they capture whatever was needed, so that people can be paid. So we have members of the health force, doctors, nurses, other members of staff administrators who have not been paid for a long time. And so that is one reason for the strike. As we speak, Dio, in some states, for instance, Abia, Imo, Ekiti, Ondo, doctors in those states are being owed so much. Some places like either Abia or Imo, they are being owed 19 months' salary. And we ask ourselves, it's inhumane that you owe an individual, not just a doctor, but any individual at all, The good book says that a worker is worthy of his wages or her wages. But you imagine that a government is in position, in place, and that government has refused to pay these workers for 19 months, 18 months, 13 months, like that. So, you know, it is unacceptable. Those are the issues they raise. The other is that the training that we do, you know, people do these trainings under very difficult, severe conditions. We shouldn't increase the yoke, you know, upon them. You know, we should lighten it. Now, somebody is in UPTH and the person goes to UNTH to do a training. That individual is expected to pay a certain fee to UNTH, you know, management. The resident doctors are saying no. It's the same training we are doing. Let us be able to do this training without adding this fee to it anymore. In principle, they agree. The federal government agree. The state governments too agree. But implementation has been a problem. And so when it concerns members of the public, members, you know, in this very instance, in the health sector, doctors, you find out that that response is not there. Of course, I've never heard, I don't know, Dayo, you are in the public domain, you hear to me a lot of things, you know, you pursue news every day. I don't know if you have heard that the senator was not paid salary for 2 months. I've never heard it in Nigeria. I've never heard it.
Never as well.
Yes. In fact, their newspaper allowance, which runs into 700,000, is paid regularly. Newspaper allowance. We can read the newspaper on the net. If you pay maybe 5,000 with data a month, you can read. But they are being paid over close to 700 and something thousand for newspaper allowance. So, you know, these are the issues. So all these things have not been addressed. Of course, promises are made.
Dr. Please hold the thoughts. We have to go for a commercial break now. We'll return in a moment. The conversation will continue. Do please stay with us.
Headline News, Nigeria Info on
92.3.
Headline News.
Hello, thanks for staying tuned. Here are the headlines. Port Harcourt residents recount impact of your states to benefit from federal government's borrowings. PDP criticizes business owners, casinos. In entertainment, Nollywood actress Toyin Abraham denies grudge rumors between her and fellow actress Funke Akindele-Bello. In sports, House of Reps investigates disqualification of Nigerian athlete at 2020 Olympics over alleged doping. And those are the headlines. Details at 6 p.m. Contact our newsroom on 0818 90017. Thanks for listening. I'm Adedayo Elusakin. Good evening.
Information is a two-way thing. Nigeria Info, it's your turn. Let's talk.
And now, Hard Facts. Hard Facts with Dayo.
Welcome back. Still Hard Facts to Nigeria Info and Port Harcourt and Dayo. Discussions continue. Thank you for staying tuned. MDCAN extends ultimatum given to the federal government to resolve the demands by another 6 weeks. My guest is Dr. Chukwuemeka Agi, who is chairman of MDCAN at UPTH. Dr. Agi, you're welcome once again.
Thank you.
Before the break, I was going to ask you a question, actually. I asked you about your position, or MDCAN's position, regarding NAD strike. You did express support for their strike at the moment, saying you're on the same plane with them. However, some events suggest that may not entirely be the case. There were reports recently about some meeting broke up between government and professionals in the healthcare sector, doctors especially, unions represented, MDCAN, the NMA, your umbrella body, resident doctors, of course, NAD as well. Reports were that certain agreements were signed, MOUs reportedly signed by NMA, reportedly signed by MDCAN as well. However, NAD refused to sign its version of this MOU, citing certain irregularities. So one might wonder if the NMA or MDCAN, as is for the purpose of this conversation, agrees with NAD that these issues do exist and need to be resolved, why then would the NMA or MDCAN go ahead to sign these agreements and NAD would not append signature to it?
Well, I agree with you that there appears to be some seeming difference or disagreement among the various unions within NMA. NMA is the umbrella body for all doctors. And as you know, we try as much as possible. Where there are disagreements, we want to bring parties together to discuss, to deliberate and to see how we can forge a new, front. So NMA went into that discussion at the beck, the call of the president. So they saw the president of the federation, President Buhari, and they had that discussion and then brought out the MOUs for members to sign. NMA signed, however, but the issues have not, been adequately looked at. That's the way I'll put it. The reason being that, you see, I cannot be asking you to come out for from court for a negotiation, and then while we are having the negotiation, you go back to court. And that is what the federal government has done, going back to court, instituting a court case, asking with the judge, stating that, the NAD must go back to work and then, things must go back to status quo ante. And so I agree that, when we, sign these memoranda of understandings or actions or whatever, and they are not being kept, it becomes, wasted paper, wasted ink. So NAD not signing it is still okay. We in MDCAN, we actually stated that, look, we support NAD, but we have given time to see how this can be resolved. We all cannot, in quotes, be, at loggerheads at the same time. If, however, after 6 weeks, which MDCAN has stated, nothing is being done, no progress is made on all fronts about the things we are, concerned about, then unfortunately, it will be going to, MDCAN join in. So we are hoping that it doesn't get to that stage. But right now, it's like a father. We are older. We are, the elder group in NMA. We are the eldest people, the top guys there. But we are also ensuring that we guide the young ones properly. The person who is the younger person today or the junior will become senior tomorrow. People are retiring. People are, giving way for people, others to come through. And so we must ensure that, things are done, at least with some order and understanding. So we are trying to temper their enthusiasm. They are younger people, they have their ways of doing things, but we are trying to guide and, mediate, so to say.
But Docs, one might also struggle a bit to understand the NMA or MDCAN strategies, really, as far as resolving these issues are concerned. As far back as late July, MDCAN threatened to embark on a strike, giving the federal government a 21-day ultimatum. Yeah. The strike, as we now know, did not happen, is not taking place. As far back as just about 5 days ago, this was published by The Punch on September 17. Medical dental consultants threaten strike over unpaid arrears, and then now we're hearing again that we're giving government another extension as far as these deadlines are concerned. Why is the NMA or MDCAN doing this? First 21 days, now we're threatening a strike. Now we're saying, okay, we'll not go again. Okay, we'll give you another extension. What is MDCAN exactly doing here?
Well, I agree with you. It almost makes us look as if we're unserious, as if we're not, true to our words, as if we don't mean what we say and say what we mean. But in truth, there are so many things, so many factors. The president that, in late August and early September, we had a change of leadership. We have a new national leadership brought on board. And so the old one was saying, the outgoing president and ESCO was saying, look, we have negotiated this thing to this extent. Now, if we have a 5-point agenda and we were told, look, they have done this. The National, Salaries and Income and Wages Commission brought out a memo that said, doctors in the university should not be paid in, like this. Withdraw that, circular or that says pay them. Now they have abandoned that. They have, stopped that memo. Then the other thing is they have agreed that, in terms of retirement, this is what would be in place. People can retire if they get to 65 and all that. Because we mentioned to them, you are retiring people so early, and then there is we're not getting enough doctors to fill the places. In terms of, population to a doctor, it's almost 6,000 to one doctor in Nigeria. It's almost, but World Health Organization says between 300 or thereabout, one doctor to 300 patients or people. It's so much, yet you're retiring people. So with all that, so when this new ESCO came on board, they said, look, give them a chance. So, they have done 1, 2, 3. And then we deliberated at length. Of course, in deliberations, it's a democracy. When you vote and you are voted, even by one vote, you must, lean and accept what the voice of people have said. So we voted, and it was said, no, let's give them a little time. But this is the last from what we agree, because we are let's not become a joke.
If the issues between the resident doctors and the federal government are not resolved before your most recent deadline elapses, will MDCAN embark on the strike?
Yes, we will. And the reason, you see, what NAD is asking for, a lot of those things involve MDCAN as well. Payment of arrears, of shortfalls of salaries is there. Registration, going from one platform called the GIFMIS platform to a new platform called the IPPIS platform. It affects resident doctors, it affects consultants, it affects other workers in the hospital. So they are there. Payment of, insurance to those doctors who die in service. As we speak, there are doctors who have died from COVID. So many. This year we've lost a professor of obstetrics and gynecology, a referred professor. We've lost him to COVID. We've lost other people like that, to various other infectious diseases. Now, Dayo, as you and I speak, for our hazard being exposed to some of these threats, bacterial threats, physical threats, electrocution and all that, What we are paid monthly is 5,000 naira as hazard allowance. 5,000. So we mentioned that it is not true. It shouldn't be. So with all this, what NAD is fighting for is exactly what the consultants also would benefit from. So it is there for everybody to see. So if those things are not attended to, are not addressed, we will go on strike. Because at least now the naysayers, those who say, oh, don't do that, let us give enough room, would have given enough room. Like the adage says that it is the fly that has no advisor that follows the corpse to the grave. So we would have given enough room, enough chance.
Well, the 6-week extension, I believe, will elapse by the end of next month.
Yes.
Hopefully, discussions will be fruitful. The federal government will yield. We'll see how it goes, and whatever happens, I imagine that between now and then, we'll have further conversations, discussions on what the situation is. However, we have to wrap up the conversation at this point. Many thanks to joining, especially my guest, Dr. Chukwuemeka Agi, is the chairman of MDCAN at UPTH. Dr. Agi, many thanks for your time.
I'm grateful for the opportunity. Thank you.
Got a commercial break coming up right now. Major news about the hour at 6 p.m. If you've missed out on any matter discussed on the show today, including my side comment, I'll take your thoughts on those after the major news at 6 p.m. Do please stay with us. Hard Fast continues in a moment.